So you will find people who are eating a large volume and are still very slim.
Yes, and it could be not the hereditary obesity but the hereditary metabolism.
And if there is an imbalance in metabolism, that is the amount of calorific intake that we are taking versus what we are burning.
The 60-70 other diseases that come with obesity or if you are obese.
We rather focus on the diseases, or we call them as comorbidities.
Since 1975 until now, obesity have tripled.
Surgical treatment of obesity.
Welcome back everyone. Namaste. Today we are here discussing something very interesting. Why I'm saying interesting is this a very common problem. This is increasing with the sedentary lifestyle that we are having, with the kind of lives that we are living, the kind of food we are eating. I think with every habit that's changing over decades and years, with every kind of work that we are doing, our food habits. Let's see what that is. Today we have here with us Dr. Atul Sardana, a senior laparoscopic and bariatric surgeon. Hi sir, welcome to the episode. How are you?
Thank you, Sumati. I am good.
So something while I was introducing you, and I also want to understand the terms, the technical terms when we say you are a laparoscopic and bariatric surgeon, which has taken me a lot of time to remember this. What exactly your profession holds and what do you deal with every day?
So laparoscopic surgery is basically doing surgery of the abdomen without opening it.
Okay.
So we make small holes, what you call as keyhole surgeries or buttonhole surgeries.
Okay.
And we put in specialized instruments, camera systems, and we do all sorts of surgeries.
Okay.
And whereas bariatric surgery refers to surgical treatment of obesity,
Okay.
wherein we find patients who are quite obese and then surgery is an option for them.
Okay. So in particular, basic surgery, something I heard is you would be dealing with a lot of obese patients who are dealing with obesity. Patients who are coming in and a lot of abdominal issues also.
Yeah, so obesity is not about abdominal issues. Obesity is a generalized
Okay.
disorder.
Yes.
It is multifactorial. There are many factors to it.
Okay.
And it also affects each and every system of our body.
Yes. While let's have a conversation, I think something very important is, that I was just reading and going through a lot of data when I got to know there was this particular research by WHO which mentioned that since 1975 until now, obesity have tripled. There was another research that I was going through is that 2022 there was this research paper that came out that 16% of the adults aged 18 and above are obese, which is a huge number.
Yes.
And obesity in general, households, it's as simple as we meet and we, our relatives will just tell us, oh आपने weight gain कर लिया है, oh आप मोटे हो गए हो. And हमारी families में कई बार ये accept भी नहीं करता है कि मोटे हो गए. It's as simple as, there's this funny tone that you always get, and particularly our mothers won't ever accept that we are fat or we are getting obese. They'll just say, अच्छा healthy hai, chubby hai. First of all, when we talk about obesity, what exactly is obese? What weight? How do you consider somebody obese?
Alright. So obesity is a generalized disorder. It has many factors to it. One factor is genetics. So you find that if there is obesity in the family, then the children are also obese. Secondly, it's more to do with your lifestyle, the kind of food you eat. And as you were right now mentioning that obesity has tripled over
Yes.
the last number of years, that's basically because of availability of food, And so it's basically a balance,
Yes.
what you burn versus what you eat. So in
Okay.
case you're burning less, you have a sedentary lifestyle and you're eating food which is rich in calories, rich in fat, then you're gaining on weight. And yes, I know social acceptance is an issue. Obesity we normally consider as a social disorder, whereas
Yeah.
it is not.
Yeah.
People somehow tend to not accept saying healthy hai,
Yeah.
khate pite ghar ka hai,
Yeah.
and all these kind of statements. Or then there is body shaming.
Yeah.
People are outcasted, and obese people find day-to-day activities also very challenging, something which we take easily. Even wearing shoes
Yeah.
is a big challenge for
Yeah.
obese people, because so this is the social aspect of the disorder, but there is a bigger medical aspect to it, the associated diseases and disorders it brings with this.
Yes.
And our focus is purely, not on the social or the physical aspect, but as a surgeon, as a bariatric surgeon, we rather focus on the diseases, or we call them as comorbidities, that obesity brings along with it.
Okay. While you're mentioning this, there was another, details that I was reading by obesity, and it says that there are 60, 70 other diseases that come with obesity, or if you're obese. As simple as you will have breathing problems, you will have heart problems, you might have strokes, a number of things. As simple as you mentioned, you might have problems doing basic tasks.
Yeah.
No? So, you being an expert, you would be dealing with a lot of patients who are coming in every day, and I think every patient will have different problems.
Yeah.
Nowadays, there is another thing that we are seeing. Earlier, we used to say that if you are slim, if you have this particular weight, you look good. Now, with more awareness, we just used to say if you're fat, that means you're not eating healthy or you're not exercising. Just two things we used to have. Now we also understand, with more trends in social media, when we are hearing it from the people who are not able to lose weight, we are understanding that there are a lot of problems that lies behind, other than just eating healthy and food. I want to ask from you, that could be a myth, could be true, and what are these problems that if a person is eating healthy, is working out, why can't a person lose weight?
Right. Okay. So obesity per se is a disorder of metabolism.
Okay.
See, metabolism means the food that we eat, we metabolize it
Yes.
into the daily requirements of the body. And if there is an imbalance in metabolism, that is the amount of calorific intake that we are taking versus what we are burning.
Okay.
If there is an imbalance, and that imbalance is towards the positive side, as in every day, let's say you are supposed to have 1800 kilocalories and you are taking 2100. So where is that 300 going to go? It's going to keep adding on to your body.
Yeah.
And that addition is obesity.
Okay.
So, and every individual would have a different metabolism.
Yes.
So you will find people who are eating a large volume and are still very slim.
Yes.
And you will find people who eat very small quantities and still are obese.
Yes.
So it is a metabolism issue. And obviously, when you have a genetic predisposition, when you are not taking proper diet, when you are not doing proper exercise, you tend to gain weight more and more. And as far as clinicians, as far as we are considered, we use a scale known as BMI, body mass index,
Yeah.
in which we take the height of the person and the weight of the person, and we calculate the BMI. And we say that an individual who is between 18 and 20 is a normal healthy individual. Anyway, between 20 to 25 is getting overweight,
Okay.
and so on. So for us as metabolic and bariatric surgeons, we always consider any person having a BMI of 35 plus as a surgical candidate, in
Okay.
case they have any comorbidities. And I will come to comorbidities
Yeah.
because they're very important.
Okay.
Or if you have a BMI of 40 plus, then you are a surgical candidate.
Okay.
And so we always, do a very scientific approach towards things.
When we'll come to, as you mentioned, 35 and 40 BMI, right? If we stay in the range of 20 to 25, or you also mentioned somewhere in the starting that this could be hereditary.
Yeah.
And it could be not the hereditary obesity, but the hereditary metabolism problem.
Yes.
Can we rectify it on the basis of a life, or if you have metabolism issues, you need to be medicated, or there are some preventions or some things that you can do in general life to avoid the problems?
So see, let's say your metabolism requires you to have a certain amount of food,
Yes.
and so there is one way of curtailing. So I would not say curtail your diet, but eat a healthy diet,
Okay.
eat a balanced diet, focus on what is required in what proportions. So I personally believe anything which is packed or bottled
Yes.
is not good for you.
Okay.
So that's the basic dictum. So people should focus on eating healthy. That is one. Second way of keeping your weight in control is obviously adding exercise to your lifestyle. Now why these diseases are increasing, because one, we have availability of food, and two, our lifestyles are becoming sedentary.
Okay.
See, we are out of exercise. We are always on media, we are always on television, we are always on the
Yeah.
phone, and plus, you know, for even small things like going and buying, you know, some food, vegetables, grocery, we are using some kind of a vehicle. We are not even willing to
Yes.
walk 500
Yeah.
meters. That's the problem nowadays. So add exercise to your lifestyle and eat proper food is the first thing. The second thing is, in case you have a metabolic disorder, do consult a doctor.
Okay.
Some of them could be hormonal, and sometimes they are correctable, like thyroid disorders or cortisol disorders. So that is all.
Something that I want you to shed a little light on would be, I don't know if it's related to obesity or not, but being an expert, is gut health. You know, there are always trends, and we have been discussing this particularly after COVID and with social media being filled with these questions. Is gut health really important, and is any way related to obesity and metabolism?
So gut health is very important. See, the microflora of the gut is basically your second brain.
Okay.
There is an exocrine function that it has, and eating healthy food is primarily important.
Okay.
And in case you are eating unhealthy food, your gut flora is disturbed for some reason or the other, it leads on to other metabolic problems also.
Okay.
So that's very important. And these metabolic problems or this obesity per se is associated with a large number of disorders. So you can start from the head to the toe. You
Okay.
can have hair loss, you can have retinal issues, you can have brain strokes, poor oral hygiene, poor personal hygiene, because you can't reach out to places, you can't lift your hand. People are so obese at times.
Yeah.
They can't move their bodies properly. Then they have these sores. You have, chances of having diabetes. Diabetes is very commonly associated with obesity, hypertension, dyslipidemia. Then you have chances of having a heart attack, hernias, varicose veins. So you name it, in each and every organ of your body is affected by your weight.
Okay.
So, and when I'm talking of a person of, let's say, 45, 50 BMI, I'm talking of a person in general who is carrying double the amount of body weight. So if, let's say, your body was designed to carry 65 kgs for a male, and you are carrying 120 kgs or 130 kgs, you are carrying one guy on top of you.
And
It's like,
all the time.
and all the time.
Yeah.
It's just not once. It's like, people do these strength training exercises and they carry weights on them. It's like all the time you have another 60-70 kgs laden on your body. Imagine the amount of stress you're putting on your back, on your joints, on your knees. These people have very frequent issues of backache. They have very frequent issues of, their knees going bad, osteoarthritis. So it's a huge disorder.
Comes as a shock, I think, if you imagine it or see it that way. Now, I think enough of me asking. Something I want to understand. आप deal करते हो हर रोज patients से who are coming with metabolism problems, who are coming with issues of obesity. Some are because of the sedentary lifestyle, some might not be. Every patient is different. Something we want to understand, what are most common trends that you are seeing, what kind of very common problems that you are seeing. आप किन चीज़ों से deal कर रहे हो with the patients? Something if you can.
So most of the patients that we are getting for obesity get referred to us, by specialists of other specialities. Like an orthopedician would be sending a patient who spoiled their knees at a very early age, and now they want to do a knee replacement.
Okay.
But since the weight is much, they want the patient to first lose weight.
Okay.
Similarly, we get a lot of hernia patients who are obese, a lot of varicose patients who are obese. So obesity per se, there is no generalized trend in terms of age. We get obese people ranging from very young children, say about 16 years, 14 years, and we get them as old as 60, 70, 80 years. Unfortunately, obese people have a shorter lifespan as compared to a young healthy or a healthy individual. And that's because of the comorbidities that they catch at a very early age. So if you are obese, then maybe in your early or late 30s or maybe in your early 40s, you're very prone to catching diabetes, you're very prone to catching these chronic disorders, and that tends to bring down your life expectancy. Secondly, most of these people know that obesity is the cause of their disorders. So they know that I am hypertensive or I am diabetic or I have this, and it's because of the weight. But the common thing that we find in them is that all of them have tried their best to lose weight with diet and exercise,
Okay.
and they tend to fail. So data says that, and we also want that diet and exercise is the first line of treatment.
Yes.
That if you can lead a healthy lifestyle, if you can eat proper food, if you can do some kind of exercise, keep your weight in check, that's the best form of it. But unfortunately, say, even less than 5% of patients who lose weight on diet and exercise would maintain it over a period of 5 years.
Okay.
This is documented. So 95% of them will bounce back.
Okay.
And that bounce back is because of the metabolic disorder that they have.
Okay.
So there is a sort of an insulin resistance. I'll not get into the nitty-gritty of it because I'm sure your audience needs to understand that, let's assume there is a bulb which is 100 watts, so it consumes 100 watts of energy.
Yes.
And there is this bulb of 10 watts which consumes 10 watt.
Yes.
So these obese people are actually 10 watt bulbs.
Okay.
So they require less energy to give the same amount of light,
Yes.
right? So they're smart bulbs, or they've been designed like that by God.
So they're smart bulbs.
They're smart bulbs, they're better bulbs.
Yeah.
So your LED will take less amount of energy,
Yes.
and your incandescent lamp would take more amount of
Yes.
energy to give the same amount of light. So these people require less amount of energy, but unfortunately they are eating like you are eating, or I am eating, or anybody else is eating. So they would require, let's say, 1600 kilocalories, and they are eating 2100 kilocalories, which is the recommended kilocalories for an adult. So these people will tend to put on weight. They are all aware of their problems. Unfortunately, it's not in their control. It's not something they can do easily. So there steps in some kind of professional guidance, whether it's in the form of a diet lifestyle change, whether it's in the form of a bariatric surgery, but they definitely need these. See, in the Indian population, we've done a study, we've had a core group committee, and we found that for a Western population where we say 35 BMI is your cutoff for considering bariatric surgery with comorbidities, in Indian population we say it's 33.5.
Okay.
Because Indian fat distribution is quite different. It's more of within the abdominal cavity, and that is very bad for your heart, or makes you more prone for other disorders that are associated with obesity.
Okay.
So this is the kind of things we see. We see patients coming in, young patients coming in. We see all of them have tried diet and exercise. All of them have had failures or rebounds. And they personally, most of them, are actually volume eaters. We don't realize. So when we actually counsel them, we take down their diet, we realize they are volume eaters because they eat many times a day. They eat large quantities or quantities larger than that is required. And the mid-meal snacking, what we say, between lunch and between dinner, we'll have a samosa, or we'll have something, a fried food or some. So this mid-meal snacking, or I would say non-intelligent snacking, is one of the common things that we find with these people.
Is it where they are mentally conditioned? Because when you mention that there's already smart bulbs, they might need less food, but because you're mentally conditioned that you have more weight, or you might need more food, and or does that the trends that you are seeing, that, or is it the habit that builds up of eating? And
so there are two things. One is the family where we actually live, or the peer group that we are sitting with. So we will always eat what everybody else is eating.
Yes.
It's not as if I'll say I'm going to have salad and you all can have samosa. It doesn't work like that. So if we are sitting, we are all going to have that. So that is one problem that these people face. So they are sitting with everybody, and everybody is having whatever they're having, and these people will also have that. And the second thing is, we see it with obese individuals. We also see it with patients who've had bariatric surgery. Is that there is very little support from the family in terms of intelligence. They will support you, they empathize with you. Your family knows that you are obese. Your family wants you to lose weight, look better. Your family stands with you in this surgery or after surgery. But their thought processes, most of the common questions I get is, बस अब ये इतना ही खाएगा. बस अब इतने से ही इसका काम हो जाएगा, इसको कमजोरी तो नहीं होएगी. You know, it's like a 10 watt bulb being fed 10 watts of power, and the 100 watt guy saying, oh, will he manage with 10?
Yeah.
And that kind of doubt, and that doubt, you know, then extrapolates onto the patient himself.
Yeah.
So these are the social trends that we are seeing with these patients.
Going to a little of when you mentioned bariatric surgery, it might be known to a lot of people. This particular term might be foreign to a lot of people, because when I came on to here and I was discussing, I was like, oh really, we have surgeries for obese people? At what stage, as you mentioned, you know, if for Indian population it's 33 point something and 33.5, and for generally it's 35 around, when you need a surgery, what kind of symptoms you would be seeing when you know that okay, now is the time that, you know, you need to have the surgery? What happens in this surgery, and what exactly does this surgery holds for the person who's coming in?
Right, very interesting. So bariatric surgery is offered to individuals who have failed to lose weight on diet and exercise, or have been unsuccessful in maintaining that weight loss, and we want them to have at least 2 episodes documented.
Okay.
We rule out any kind of hormonal issues, because like thyroid or adrenal. Then, you know, we also understand that a lot of patients who come with who are obese come to us with a lot of comorbidities. So we have to do a lot of workup with them in terms of you know, managing their diabetes, managing their hypertension, you know, looking at the issues or the complications that they could have after surgery, counseling them.
Yeah.
You know, most of them are snoring, they have obstructive sleep apnea. So these guys snore in the night, they have tongue fall, and then they are sleepy throughout the day.
Okay.
So, and
Are not having proper sleep.
they are not having proper sleep, and because of that they have certain changes within the brain, and they are likely to require some kind of ventilatory support after surgery, some kind of positive pressure. So we need to work up all this. Once we worked up all this, and obviously as I told you, the recommendation for surgery is anybody above 33.5 BMI with comorbidities, and comorbidities means hypertension or blood pressure, diabetes or sugar. Then you have previous histories of stroke, you have osteoarthritis, you have varicose veins, you know, you have dyslipidemias, you have, so these are the things. Or if you are per se above 37.5 BMI without comorbidities, then you are a surgical candidate.
Okay.
Surgery is very structured. We don't rush into surgeries with these patients. As I told you, we work them up completely. We try to understand their medical disorders. It's a multidisciplinary approach. Not only the surgeon but the physician and other specialties are also involved. So what we per se do in surgery is that we have 2 types of surgeries that we practice in India. The first type is a restrictive surgery, in which we restrict the amount of food that you can take in.
Okay.
Right. So we realize that you have a lesser requirement of food. So how do we reduce that food intake? So we've in the past been using products like bands, balloons, which we put into the stomach, but since these are foreign bodies, they tend to have their own sort of complications. So now currently what we have in vogue is a sleeve gastrectomy. We make a stomach like a small tube, which can accommodate about 120 ml.
Okay.
And so that restricts the amount of
120 ml.
120
It's like
ml.
just this bottle.
Which is smaller than a 200 ml Coke bottle.
Again, I'm coming with my perceptions
Yeah,
of a 100 watt bulb. But
कि इसने से हो जाएगा
हाँ,
इनका काम,
इतने से हो जाएगा।
इतने से हो जाएगा, but yes, they do well.
Okay.
And they lose weight.
Okay.
And they are fit and they maintain that weight loss.
Okay.
So with bariatric surgery, the weight loss maintenance is, you know, 90 to 95% at 5 years. Exactly the opposite of what it is with diet and exercise.
Yeah.
The second type of surgery that we offer in individuals who are a little elderly, whom we expect would not be doing a lot of exercise because maybe they've had their knees, you know, destroyed because of osteoarthritis, or have backache, or have, you know, disc bulges and all that, and are long-standing diabetic, long-standing hypertensive, is we combine the restrictive procedure with a malabsorptive procedure.
Okay.
So not only will you be eating less, your intestine will be bypassed in such a way that you will be absorbing less also.
Okay.
So you will be absorbing less. So these people fare better than just the restrictive procedure, because their weight loss, expected weight loss at about say 18 months is somewhere around 80% plus. So let's say you are supposed to be 50 kgs or 55 kgs and you are 110 kgs,
Yeah.
or let's say 100 kgs from, so you have 50 kgs of excess body weight. So when I say you will lose 80% of your excess body weight, you will lose about 40 kgs.
Okay.
So from 100 you will come down to 60 or maybe less than 60. So which will be very near to your desirable, and that also depends upon the individual, the patient,
Yeah.
you know, how much effort the patient puts in, how rigid he is with his diet. With a purely restrictive procedure, this would vary somewhere between 70 to 75% of excess body
Yeah.
weight loss. And this excess body weight loss does not happen when you are out of the OT. It's not as if you are going into the OT and you're coming out slim. We are just changing some connections inside.
And
We are
that
just,
will happen slowly.
it happens slowly. It happens slowly because your body needs to adjust to
Yes.
it. But the good part is, most of these patients will lose their requirement for BP medication, for sugar medication immediately after surgery.
Okay.
That is the surprising part. The weight loss will take time, but their requirement for the medicine goes away immediately. So there are a lot of theories around it, but that's the best part of this surgery.
So we were discussing about the surgery, and you were telling the procedure. Eh? So right now, again, you know, asking from a perspective of 100-watt bulb, when you are saying that, you know, when you, so something I was just trying to, you know, understand, and ये जो मेरा जो bulb है वो इस समय यही कह रहा था कि when you mentioned that there are two kinds of surgeries, one where you just reduce the capacity of the stomach to, you know, for the food, and another one is where you also reduce the capacity of the intestines to absorb.
Yes.
Now, a body needs nutrition. So you are saying that if a person who's eating 120 ml, वो absorption भी कम होगा, तो how will that person get the right nutritions? And
So nutrition per se consists of the three primary nutrients, that is carbohydrates, proteins and fat.
okay,
These people are on a structured diet, so we put them on a structured diet pre-operatively.
okay,
So say about 10 to 15 days before surgery, we put them on a very low calorie diet. We want to see their compliance.
yeah,
We want to see their determination towards, you know, this, and we call this as a transformation.
okay,
We don't call this as a surgery
yeah,
because it transforms the individual.
yes,
It transforms the individual not only from the medical perspective but from a psychological perspective, from a social perspective. So for this transformative surgery, we need to see their conviction, we need to see their compliance. So 10 to 15 days, we put them on a very low calorie diet.
yeah,
Plus post-operatively, the next morning we start them with liquids.
okay.
So
So
it's
this is post
Post-operatively,
okay.
let's say you got operated today, tomorrow
Yes.
you're going to start on liquid.
Okay.
We keep them on a liquid diet for 15 days.
Okay,
But we ensure that their nutrition is correct. We ensure that the micronutrients and the vitamins and the essential things that they're getting in adequate amount which is required for their
Yeah.
body. And then another 15 days we put them on a semi-solid diet. And then after a month, you know, they are having everything that you are having but in much lesser quantities. Let's say they are going to a wedding, they'll pick up the same naan as you but they won't eat the full naan.
Okay.
They will eat the 1/4 naan because they require 10 watts only.
okay, cool. Okay. Now this was you know, a lot of information for the people who might have BMI or be in the 35, 33 and, you know, much more than that, and being in the surgery category. Now if we come to a little, you know, from where we started the discussion, if a person has a BMI of 20, good, they are healthy. Now something that a lot of, you know, doubts that and myths and discussions that we have around, coming from a family where you are, you know, always encouraged, we say that you shouldn't eat junk food,
Yeah.
but eating, you know, ghee and butter is considered healthy. From an expert, I would like to understand, we do know there are right carbs and wrong carbs, there are right fats and wrong fats. In same words, there are right proteins and wrong proteins also. But is it okay to keep going on those ghee and makhan because it's healthy and, you know, it will make your bones strong? Or if a right amount of carbs are okay, then is junk food also eating okay to a particular measure?
Right, okay. So the first part of your question that I got very clearly was that since ghee and butter are good,
Yeah.
can we have a lot of them?
Yes.
And no, there is a concept of balanced nutrition.
Yeah.
So according to your weight, according to your height, according to your lifestyle, everything has to be had in the right proportions. Anything in excess is not right. You know, excess of anything is actually poisonous. Excess of anything will be poisonous.
Yes.
It's going to work the other way around for
Yeah.
your body. And secondly, when you say junk food, then if having something in the right proportion, why not have junk food in the right proportion?
Yeah.
So junk food is called junk food because it's not balanced.
Okay.
It's not balanced. So let's say I'm giving you a slice of pizza. What does the pizza have? A very small topping of, let's say, chicken, which
Yeah.
is protein. A very large base of
Cheese
maida,
and maida.
which is carbs,
Yes.
and a lot of cheese,
Yeah.
which is fat.
Yeah.
So it's an inverted pyramid.
Yeah.
It's the other way around of what actually should be.
Yeah.
And plus it would have other chemicals which would be harmful for you, MSG, you know, preservatives and
Yeah.
other. So junk food in any quantity is not right.
Okay. Something that we want for every person who's listening this, and we want it to come from an expert, so people also pay attention and they take it seriously. You have been dealing with a lot of people every day who are having a lot of problems to a certain extent that they might need a surgery, but you will also be having patients who are just, you know, started having problems because of overweight. And I'm sure something I wanted to understand, that do you only think that coming to, of course, the right expert, but do you think in a lot of cases people might need mental and psychological or psychiatric help just to deal with these problems?
Okay. So psychological help, yes, of course, why not? Because these people have a lot of issues in terms of the way they are accepted by the society, the way they are, you know, body shamed.
Yeah.
And it's not their fault. It's not their fault. They're basically 10-watt bulbs. That's
Yeah.
it. And as far as psychiatric evaluation goes, you know, we in selected cases also take psychiatric evaluation for our patients, because for us, you know, after surgery, the results would, you know, be totally determined by the fact that how well the patient is compliant
Okay.
to, you know, the diet and lifestyle changes that are required.
Yeah.
So both of these are very important.
Because a person might need less food, but going according to the mental health, a person might want to eat more.
Yeah, yeah.
So
that's the reason why diet and exercise fails in the first place.
yeah.
Because if I give you a certain diet plan which is, you know, lesser in calories, you will adhere to it for a couple of days.
Yeah.
But till how long will you keep this feeling of I am hungry in you?
Yeah.
It doesn't work, and then you will go cheat. You know, you will binge on food, and you will rebound back. So this is what this surgery does. It actually, you know, not only reduces the size of the stomach, but it also tackles certain part of the stomachs which give this hunger hormone feedback.
Yeah.
So this hunger hormone, this feeling of I am hungry goes away. In a small quantity of food, since your stomach is small,
Yeah.
you get this feedback of satiety,
Yeah.
which says I am full. See, we will all eat food. When do we stop eating food, something we love? You know, if we have something we love and we are eating it,
Yeah.
we will eat till we say I can't eat
Yes. Yeah. Like
Yeah.
I'm full.
Finally
also,
I'm full.
Satiated now
more.
that
And
I'm happy.
I have heard a wonderful thing from a
Yes.
small kid which says, पेट तो भर गया पर मन नहीं भरा है. So
Yeah.
so it's like that. So that signal. So our idea of reducing the size of the stomach is to give this signal earlier to the brain, so that the patient stops eating.
You know, one thing that I also want to ask is that there's something, you know, I heard while I was just, you know, going through something I was reading about nutrition, that so it's as simple as when you said, you know, you throw a ball, but sometimes it also comes back and, you know, a little more stronger. So
Yeah.
what I want to say is that you're eating healthy throughout the day, but a lot of times what happens is you try sleeping around 9, 10, you're following a healthy lifestyle, and then you can't sleep till 12, and then 12 you're again hungry, and now you will binge.
Yes.
So the diet throughout the day that you have followed, वो वहीं आके खत्म हो गई, और अब दिमाग कह रहा है कि अब जो मिल रहा है वो खा ले क्योंकि टेस्ट चाहिए. And something I read, I think this is something many years back, that you want to eat junk sometimes only for the taste because your gut is not healthy, or if you eat healthy you won't feel like eating unhealthy. something?
So basically it's your insulin surge.
Okay.
Technically what I'll tell
Yeah.
you is, if you have the wrong kind of food which is high glycemic in index,
Yeah.
food which is going to go and give your signal, body a signal that release insulin. Let's say a heavy carb food.
Yeah.
The moment you eat a heavy carb food, your body will release insulin. And since your body cells are insulin resistant, which is the problem with
Yeah.
metabolic disorders, you will want more food. Whereas if you eat a low glycemic index food, it will give you the satiety without giving you the signal that I want more food. So intelligent eating is very important. If you look at people who are very committed to maintaining themselves, they are so focused that they would not have touched a piece of burfi in years.
Yeah.
They would not have had a sweet dish in years.
Yes.
I'm not saying everybody can do that, of course.
Yeah. Very difficult.
They're professionals, they do it, but not everybody can do it. But intelligent eating, yes, we all can do. So for that you definitely need some kind of guidance. And as you rightly mentioned, there are a lot of people. So of the obese category, maybe say 10 to 15% of the people would be candidates for surgery. But the others should understand that if they go unchecked, then this is where they're going to land. So they need to control their diet, control their lifestyles, add on to exercise, and sleeping in time is very important.
Yeah.
Sleeping
Okay.
and most of these binges happen at night
Yes, because you're not
because
able
you are not able to sleep, and this sleep disorder is a major contributor to obesity.
That's a lot of new information that I have learned today. While we are talking about obesity, just before we conclude this conversation, I'm sure this is never ending. I'll have a lot of questions. Our viewers will have a lot of questions. We tried covering everything that we were hearing, we wanted to discuss, we wanted to ask. Again, one thing I'll mention before we conclude, that this is not a consultation, this is a conversation. If you feel that you need help, if you feel that there should be a professional to intervene, and you might be finding the right expert, ladies and gentlemen, we have Dr. Atul Sardana, who's an expert in laparoscopic and bariatric surgery, and who's an expert in dealing with patients and people who are coming in every day and having problems with overweight, being obese, and a lot of metabolic issues. If you need any help, you can reach out on Apollo Spectra helpline and you will get in touch with Dr. Atul Sardana. With that, ladies and gentlemen, we'll come back with a lot of these episodes, a lot of these conversations with the experts, with the right people, with the right doctors who are here with years and years of expertise, who are dealing with these problems every day. So if you have any questions, if there's a particular thing that you want to ask, do put it in the comments down and we will have a look and we'll try to get the right experts here with us in conversations to answer your queries. With that, this was all for today. हम मिलेंगे आपसे अगले एपिसोड में एक और नई इन्फॉर्मेशन के साथ. तब तक मज़े करते रहिए, खुश रहिए, हेल्दी लाइफस्टाइल मेंटेन करिए एंड नमस्ते.